Is there a best way of doing an exercise? Let's find out. Now, a lot of clients, when I'm training them, will say, am I doing it right when they're performing different movements? And there isn't a yes or no answer to that question because it depends on the individual. So for a squat, for example, if I was to line up 3 different people side by side and say to them, do some squats, would their squats all look identical? Very unlikely. What's the reason for that? So many different factors. Have they done squats before? Do they train often? Do they have previous injuries they're afraid of? Do they still have an injury that they're trying to compensate for? How is their mobility? What is the length of their torso? The length of their femurs? Ankle mobility? There's so many different factors involved with a movement. So as a PT, when I was trained to do a squat, they would say to a person, right, feet shoulder width apart, toes pointing out ever so slightly, chest nice and proud, brace the core, go down into a seated position, nice deep breath as you go down, push yourself back up, breathe out as you come up. That would be a standard way to teach a squat. Is that the right way to do a squat for every single person? No, because every single person has different factors that equate to how they would perform a standard squat. Does that mean I would correct them into doing the squat the way I was taught to teach people to do a squat? Not necessarily. If you look at how a person's doing a squat and they're going up and down, are they controlled? Are they in pain or any discomfort? How much depth are they getting? What are their knees doing? Can they keep their chest upright? There are so many different ways that you can do a squat. It all comes down to who the person is. So if you're looking at yourself and saying, am I doing this correctly? I don't think I am. Instead of saying that, comparing to everyone else you see online, ask yourself, are you comfortably performing a squat exercise? If the answer is yes, then you're doing a squat. You're targeting the muscles that you want to target. Is there any adaptations needed? Possibly. So if we look at things like resistance or putting some load on, if you were to have barbell or some dumbbells, kettlebell, whatever it might be, if you then have to compensate for that additional resistance, that additional load, and it's becoming unsafe for your body, then there may be some teaching points needed in order to make sure you're performing it more effectively. As a standalone movement, it comes down to you as an individual. So just because your squat looks different to everyone else's squat does not mean you're doing it wrong necessarily. It just means you're doing a squat that is most suited for you as a person. Remember that next time you do it.